Do any of your nails look like this or like this? Then you might have a fungal nail infection, which is something I see pretty much every day as a GP. These are very common infections and they can be really stubborn and difficult to treat. I'm sure they're not going to kill you, but they can be painful and they're very unsightly. So keep watching because I'm going to talk you through all my best tips and tricks for managing these fungal nail infections and also, really importantly, preventing them spreading and maybe even preventing them in the first place. Okay, so what options do you have for managing them? Firstly, you could do nothing. Sometimes it's a very mild infection and your body can sort it out by itself. I would say that if you've got something like diabetes or vascular disease, it's best not to ignore it and do go and get some treatment. Okay, so you could go and see the pharmacist. They can give you over-the-counter treatments such as nail lacquers and creams. These only really work if it's a very superficial nail infection, so if it's only kind of right on the top of the nail. You can make it more effective by filing the nail down and cutting off any of the abnormal nail before you put on the nail lacquer or the cream. But they don't work in most people and they can take up to a year, especially on toes, so you've got to be really patient. So not ideal. Okay, so the next thing you could do, you could come and see your GP. We can prescribe oral antifungal medication, so tablets, such as something like terbinafine. Now you also have to be patient with this because on toes this can take up to 16 weeks to work and it works only in about half the cases. And I'm usually quite hesitant to prescribe these because they have got some quite significant side effects. They can make people feel pretty lousy but also can affect your liver. So before we even think about prescribing them, we have to get a positive nail sample. So we ask you to do a clipping and we send that off to the lab to confirm that there is a fungal infection. And we do some blood tests to make sure your liver is okay. So definitely not for everyone. And a lot of people actually stop taking the tablets before the treatment is up probably because of the nasty side effects. So again, not ideal. In very severe cases, you can have the nail removed completely, which always makes me cringe. Well, something about that. So obviously that's just for worst case scenario. There are some home remedies you can try. The NHS doesn't actually recommend these, but if you want to give them a whirl, I thought I'll just tell you what they are. So some people suggest you could put tea tree oil on your affected nail twice a day. You can use a baking soda paste and just kind of paint that on the nail and leave it on for 10 minutes before you rinse it off. Or you can use a vinegar soak for about 15 to 20 minutes every day, about 1 part vinegar to 2 parts warm water. Maybe it'll work, maybe it won't. Up to you if you want to try. And there are some new treatments that are very promising. We need a bit more evidence, so they're not yet available on the NHS. You may be able to pay for them. And that includes things like laser and ultrasound. So keep a lookout for that. So as you can hear, the treatment options aren't actually brilliant. So what I'd suggest instead is you focus on how to stop it spreading and how to prevent them in the first place. Okay, so really importantly, if you have athlete's foot, so kind of the fungal skin infection, for example, around your toes, then get that treated early. Because if you don't, that can then spread into the nail and is harder to treat. So you can get treatment from the pharmacist for athlete's foot. So that's really important. Also, you need to think about your footwear and your socks. So cotton socks are good. Make sure you're cleaning them every day, changing them. Don't wear the same kind of stinky trainers every day because they may have fungal spores in. You might even want to think about replacing them. And you want to wear shoes that have got kind of a wide toe area, so there's room for your feet so they don't get all tight and sweaty. Basically, the fungus loves it damp and moist, so try and keep your feet clean and dry. Try and avoid any kind of trauma to your toenails or your fingernails. So for example, if you work in a factory, you might want to make sure you're wearing gloves. Obviously it might be difficult if you're a footballer, but essentially do what you can because that increases the risk of a fungal nail infection. And also if you're in any public spaces, then do wear something like flip-flops. Avoid towel sharing. And in fact, when you're thinking about your toenail clippers or your little scissors, don't use the same ones across all your toes and don't share them with other family members, and make sure you are cleaning them regularly. So that helps stop the spread of infection. You can also use some kind of antifungal spray on things like your socks before you put them in the laundry. And you can even buy some special like sports laundry detergent, which has got kind of an antifungal element within it. So it might be worth trying that. So I hope you found that helpful, everything you need to know about fungal nail infections. I am Dr. SophieGP, and check out my other videos if you haven't already, and subscribe if you haven't already. Why haven't you? Lots of health information that you'd probably find very helpful. Thank you for watching, and I'll see you on my next video.